Welcome to your open heart surgery discharge education, and thank you for trusting Fairfield Medical Center with your care. Our goal is to make your recovery as smooth and stress-free as possible by giving you the information, tools, and confidence you need to heal safely at home. If you ever have questions, you can reach our cardiac educators at 740-678-8261 or your cardiothoracic surgery office at 740-681-9020 for any concerns about medications, infection, chest pain, or breathing changes. And remember, if you think you're having a medical emergency, call 911 immediately. Recovery can take about 6 to 8 weeks, which is how long your breastbone or sternum needs to heal. During this time, you will follow special restrictions to support the healing process. Most patients stay in the hospital 4 to 7 days, and our case management team will help arrange any home care or rehabilitation services you might need. We recommend having 24-hour help at home for the first 2 weeks. If you don't have support or need extra help, we can coordinate home health or a short stay at a rehab facility. After surgery, you will need to balance rest and movement. Walking is key to your recovery. Start slow and increase your distance as you feel stronger. Aim to walk 3 or 4 times a day, indoors or outdoors if the temperature is between 30 and 80 degrees. You can climb stairs, but avoid pulling yourself up with the handrail. For the first month, don't lift more than 10 pounds. For the second month, limit lifting to 20 pounds. Avoid reaching, pushing, or pulling with your arms, and don't raise them above your head for 4 weeks. Your heart pillow is your best friend. Use it to support your chest when coughing, sneezing, or getting in and out of a bed or a chair. Our physical or occupational therapist will show you safe ways to move and how certain tools can be helpful during your recovery.
Hi, my name is Shelby Hufford, and I'm an occupational therapist here at Fairfield Medical Center. I'm going to be going over some education following your open heart surgery and the restrictions that you're going to have and some ways of modifying your day-to-day activities. After your procedure, you're going to have what we call sternal precautions. These are for 6 to 8 weeks following the procedure. The first restriction that you have is that you're not allowed to push or pull with your arms. So anytime you're getting out of a chair, off of the commode, or in and out of a car, for example, we don't want you using your arms to help push yourself up or pull yourself up. The second restriction that you have is that you're not allowed to lift anything more than 10 pounds for the first 4 weeks. After 4 weeks, you can lift up to 20 pounds. The third restriction that you have is that you're not allowed to raise your arms above shoulder height. You can lift your arms to about here. You can reach your face to feed yourself or shave. You just do not want to go above your head. And then the last restriction is you're not allowed to reach behind your back. After your surgery, you'll receive a pillow like this. We use this to help protect your chest, and we can use it to kind of brace the surgical site as you're recovering. You'll be using something like this when you get home from your surgery as well. Next, I'm going to be showing you how to stand up and sit down from a chair safely. You'll hear us say, hug your pillow or cross your arms over your pillow or your chest. That's so you're not inclined to push or pull with your arms when you're getting up from the surface. You'll cross your arms, tuck your elbows in tight, and then rock forward to stand up. Sometimes people need a little bit of momentum for this, so you might rock 3 times to help you to get to full stand. 1, 2, 3, and you push through your legs and come to standing. When you go to sit back down in your chair, you keep your arms crossed over your pillow. Make sure you're backed up against the surface that you're sitting on. You want to feel that chair or that toilet with the back of both legs. That way you know you're going to land safely on the seat. And then you're just going to bend at the hips and knees to sit back down. The cardiac pillow that you received after your surgery is going to be useful anytime you're getting up or moving around your home. A lot of times people will use the pillow to help kind of brace their chest. Anytime you cough or you have to sneeze, It just helps to kind of alleviate some of that pain. A lot of times we will also use some sort of like gait belt or strap to tie the pillow to your chest. This keeps it close to you, and it also keeps your hands free for you to use. I would have your caregiver or family member help to tie the pillow to your chest, because remember, you don't want to reach behind your back to do so. With the pillow tied to your chest, it gives your hands freedom to, complete any self-care task that you might need to. It also allows you to hold on to a walker or a cane when you're mobilizing around your home, and you also can just have that pillow strapped to you in case you need to brace or hold your chest for any reason. I'm going to show you how to put on a shirt and maintain your sternal precautions. So I'm going to demonstrate first with a t-shirt. So what you want to do is you're going to find the hole where you put your head and you kind of gather up that material like this. And remember, the restriction that we're trying to avoid, or that movement we're trying to avoid, is raising your arms up past shoulder height. So you're going to bend your head forward quite a bit to get this up and over your head so that your arms aren't being lifted too high. Next, you're going to put your arms through the sleeve holes. You want to think about pushing your arm out and down. A looser t-shirt is going to be a little easier for you to get on and off, so you may go up 1 or 2 sizes from your typical size that you wear. Next, I'm going to demonstrate how to take the shirt off. So you're going to grab at the neck or the shoulders, bend your head forward, and then pull that shirt the rest of the way off. So some people will prefer to use a button-up shirt like this following the procedure. I do find that it's easier to use a short sleeve shirt versus a long sleeve shirt. It'll be a little easier to get on and off. I like to actually button a couple of the bottom buttons to start. And I'm actually going to, similarly to the t-shirt, I'm just going to find that hole where you'd put your head, bend your head forward, and put it over your head. Then you're going to reach one arm at a time through the sleeve. You're going to push out and down with the arm and do each side. And then you can work to pull the shirt down the rest of the way. And then you can button the shirt up the rest of the way. To take a shirt like this off, it's much easier. You just would undo your buttons, and then you can let it fall over your shoulders and down. If you have somebody that's going to be assisting you to get dressed, one way you can put on a button-up shirt if you have support is for the patient to stand just with their arms down at their side, and then your helper is just going to put one arm in your sleeve at a time, kind of like you would a jacket, and then they'll just pull it up and over your shoulders. To take the shirt off, similarly, you could just have them help pull it down off your shoulders. There are some adaptive equipment tools that might be useful to help you more with lower body care after your procedure. The first tool that will be useful is something called a sock aid. If you have any trouble with bending forward to get your socks on your feet, this tool will be very helpful to you. You're going to take your sock and you'll slide it on the end. And you want to make sure it's lined up so that the bottom of your sock is going to go on the bottom of your foot. Then you'll use the ropes to lower it down to the floor. From here, you'll slide your foot into the sock aid, point your toe towards the ground, and then pull. And that sock will go right on your foot. The next tool that might be useful is something called a reacher or a grabber. Again, if you're having any trouble with reaching down to your lower legs or picking something up off the floor following your procedure, this might be useful for you. Next tool would be a long-handled sponge. So this is going to be great for bathing. One of the restrictions that you have is that you're not allowed to reach behind your back. You really don't want to extend that chest back while you're recovering. So using something like this to help reach your legs, to help wash your back without reaching over, this will be useful if you're having to bathe. Lastly is a long-handled shoehorn. Again, if you're having any trouble with reaching to get your shoes on your feet, this might be a useful tool, and it doesn't allow you to have to bend too far forward to get your shoes on.
It will take a minimum of 4 weeks for your incisions to heal completely. During that time, keep your incisions clean and open to air. If you notice drainage, cover the area with a small dry dressing. Avoid baths, hot tubs, and swimming for at least 4 weeks, but be sure to shower daily using antibacterial soap, keeping the water pressure away from your incision. 3 times a week, use chlorhexidine Hibiclens over the incision only and rinse all soap thoroughly. Gently dry with a clean towel and check your incision daily for signs of infection. If you are unable to shower, clean your incision using fresh, running water from the faucet. Standing water from a tub or sink could contain bacteria. Infection is a possibility anytime you have an incision or wound. Call your surgery office right away if you notice any of the following: redness, warmth, or new drainage, discharge that is cloudy, green, yellow, tan, or foul smelling, bumps around the incision, a fever above 101 degrees. To monitor this, take your temperature daily while your incision heals, new or increased bleeding. Catching an infection early can keep recovery and healing on track. After surgery, your lungs need help staying clear and strong to prevent pneumonia. Use your incentive spirometer several times a day by taking a deep breath in, holding it for 5 to 10 seconds, then exhaling slowly, followed by a firm cough. Do this 10 times every hour while awake in the hospital and 3 to 4 times a day once you're home. Always splint your chest with your heart pillow when you cough or take deep breaths. Additionally, tracking your weight daily can help you avoid complications and rehospitalization. It's important that you do this very intentionally. Weigh yourself every morning after using the bathroom, but before breakfast. Keep track of your weight on the calendar provided. And call your doctor if you notice a weight gain of 3 to 5 pounds in a few days, new swelling in your legs, feet, or abdomen, or shortness of breath while resting. These can be signs of fluid buildup and need to be addressed early. The medications prescribed before and after your surgery will help make and keep you well. Don't stop or change your prescriptions without talking to your surgeon first. Taking pain medications with food can help prevent nausea. If you experience constipation or do not have a daily bowel movement, take a stool softener, eat fiber, and drink plenty of fluids. Check your blood pressure and heart rate daily, and call your care team if you feel dizzy or lightheaded. Before leaving the hospital, make sure you and your caregiver have key supplies at home, including antibacterial soap and Hibiclens, gauze and tape if needed, a scale, thermometer, and your support stockings, your heart pillow, incentive spirometer, and any other tools that will help you stay comfortable and safe during recovery. Our cardiac rehab personalized exercise and education program is designed to strengthen your heart, boost your stamina, and help you return to your usual activities safely. Cardiac rehab usually begins about 4 weeks after surgery. Studies show that participation can even improve life expectancy, so we strongly encourage you to participate. Our team will reach out to schedule your sessions. Thank you for letting us care for you. Remember, healing takes time, and every day you'll get a little stronger. Stay active, follow your care plan, and reach out to your team with any questions. We're here to support you in every step of the way.